We are so excited that you could be with us this evening for tonight's inaugural Leading Edge Nursing Program. Yay! Nurses are critical to the health and well-being of our patients and our community, and we are so pleased to be highlighting the nursing profession for you. Our guest speaker tonight is Dr. Angelleen Peters-Lewis. She is the Vice President of Patient Care Services, Chief Nurse Executive at Barnes-Jewish Hospital, and partner to the Foundation. Our mission at the Foundation is to help donors enrich lives, save lives, and transform healthcare through charitable gifts. I can't think of a profession more linked to this mission than nursing. From patient care, outreach at the bedside, to critical care in the emergency room, to community outreach and education, our nurses are at the very forefront. And I can't think of one person who exemplifies, well, I thought it was going to be the title, compassion and science and leadership in nursing than Dr. Peters-Lewis, Angelleen. She will share with us just how the profession of nursing has evolved over time and the true impact that nurses have on patients and the community and what the future of nursing can be. We've all had memorable occasions to have been taken care of by a nurse or a nursing professional. I wonder how many ever wanted to be a nurse in the room here. I wonder how many are nurses in the room here. Yeah, okay. Before we begin the program, I would like to welcome our Foundation board members and staff members. You will notice that they have these silver name tags, and please be sure to introduce yourselves. And I'd also like to remind you that we are recording this program, so everything that happens here doesn't stay here. It's going to be put out there on the waves. I would also like to ask that if you, like so many of us, support our nurses, let's make sure I get this right, please post and share in social media that you are attending this event, and like and share the video that will be on the Foundation's Facebook page shortly after the event. And now, please join me in welcoming Mr. Bob Cannon, President of Barnes-Jewish Hospital, Group President of BJC. Okay.
So Susan left one thing out, which is that she's a nurse too. So she didn't raise her hand. Oh, there you go. And so look, first things first, thank you for coming out on this cold evening. And I know it's a little bit harder when the weather's not as good, so we just very appreciate you coming out tonight. Every time I get a chance to stand in front of you and thank you for what you do, I really want to take that opportunity. Can't imagine doing the role at Barnes-Jewish and every day the feeling of the foundation and the support that you provide to us, the generosity of our donors, and the things that you make possible that we couldn't otherwise do. So I just want to thank you again for that, and welcome you here tonight. So there are a number of members of the Barnes-Jewish team and BJC Healthcare team with us tonight. So if you'd raise your hands, that would be wonderful as well. Thank you and welcome. Absolutely. I see here Denise Murphy, who is our system-level Chief Nurse Executive as well. So we've got representation from the hospital and from BJC. So Denise, welcome. There is some remarks here, and as usual, I'll do my best to stick to them because the foundation staff gets really upset when I go off the script. So I will say that it really is important and fitting that we come together tonight to learn about the nursing profession at a time when people are living longer. New treatments and techniques are being developed, and there is a growing need for skilled and compassionate nurses. In 2019, the Foundation has awarded $1.3 million for nursing scholarships and education. And while that is significant, there is so much more that could be done to support nursing students and ongoing nursing education in this time of need. So as you'll hear from Angelleen, nurses do so much to make lives better for their patients and their families. I know we will all learn how broad and vast the nursing profession has become in meeting the ever-changing needs of healthcare. At Barnes-Jewish Hospital, we have a unique environment where nurses can expand their skills in the areas such as nurse leadership, forensic nursing, and nursing research. By understanding the core value of our nurses and embracing a culture of growth and development, Barnes-Jewish Hospital has achieved nationwide recognition for our nursing. It is our goal, along with the Goldfarb School of Nursing at Barnes-Jewish College, and I have to call out our president, Nancy Ridenour, is here as well. Nancy, nice to see you. To attract and foster the best, brightest, and most diverse group of nurses who bring compassion, care, and expertise to our community and to those in need. Our speaker tonight is an individual of many accomplishments. Angelleen Peters-Lewis received her doctorate in nursing from Boston College, where she graduated with distinction and received the Dorothy A. Jones Award for Scholarship, Service, and Development. She earned a master's degree in nursing from Northeastern University, and Angeleen's postdoctoral work included an executive nurse fellowship with the Robert Wood Johnson Foundation and the Executive Leadership Development Program at Harvard Business School. As you can imagine, this is somebody I listen to when she speaks. Prior to joining Barnes-Jewish Hospital as Vice President of Patient Care Services and our Chief Nurse Executive, which was 2 years ago now, Angelleen was Senior Vice President of Patient Care Services and System Chief Nurse at Women's and Infants Hospital in Rhode Island. Now, this is a big one. Angeleen's most recent honor, which happened just last month, is being named as a Fellow in the American Academy of Nursing, and we do want to recognize you for that as well. So it's my great pleasure, and please join me in welcoming Dr. Angelleen Peters-Lewis as she presents Nursing, the Intersection of Compassion and Science. Angelleen.
Bob and Susan, thank you for that generous introduction. Good evening, everybody. Thank you for being here tonight. I want to express my sincere appreciation for braving the cold to come out and spend time with us, learning a little bit more about nursing. I want you to feel comforted by the fact that we're making history together. The first leading edge program on nursing and historic cold together. So history is history nonetheless. I wanted to let you know that they're trying to contain me, and they're telling me I can't get that far away from the microphone, so we're going to have to figure out how we can do that tonight. What I want us to do tonight, we are all here because we are committed to the betterment of patients, families, and the community that we have the privilege to serve. Tonight, what I hope to do is honor and amplify the stories of nurses, and so we can think about how nursing can help us to achieve that noble goal. You'll hear throughout my presentation tonight a lot of passion about nursing, today's nurse, and the potential of nursing to help us transform our healthcare delivery system. I thought what might be helpful is for me to share a little bit about where that passion comes from. So who's that cutie in the picture? That's me as a baby. And I am the first child born to Caribbean immigrants. And so I'm a first generation Caribbean American. And my parents came here from the Caribbean in search of a better life, the American dream. And they had a dream that all of their children would be educated. And they encouraged us to dream really big. And we really, the three of us have done that. And my mom, I don't know if any of you guys, but my mom speaks in parables a lot. And she would say, don't play with boys because bad things happen. And I found myself at 16 with a growing stomach, and I hadn't played with a soul. And so this young child in the bed there is me as a teenager giving birth just after the birth of my first child. And I share that with you as a significant event in my life because that is when I was introduced to the power of nursing. Because the nurse I had in my life, I had an inpatient nurse and an outpatient nurse because I was really sick with nausea and vomiting. And the nurse really designed a plan of care that really met the unique needs of me as an individual. So that included, how do you take the school bus in the morning when you're nauseous? How do you make time for tutoring? And so what you'll hear throughout my presentation tonight is that some of the essential core components of nursing are about the human as they go through the most critical events in their life. How do you help them to cope and navigate those events? You'll hear a lot about the art of nursing, of designing interventions that are specific. So although I was a pregnant woman, I had unique needs. There were scientific interventions that the nurse used when she took care of me, but a lot of it was developing this individualized plan of care. The other thing I wanted to illuminate from my own story in knowing the power of nursing is that nurses act in the moment, but their interventions have far-reaching impacts. If you think about a young teen mom and what the statistics say, if I hadn't been introduced to a nurse who made sure I got education, made sure I continued to go to school, made sure I knew how to take care of my child, what she did is change the course of our lives for generations. That young boy is my son. He's now 32, college educated, with his own 2 children, and there I am receiving my doctorate. So that nurse that invested that time acted in the moment, but the implications were far-reaching and will impact generations. That is the power of nursing, and that's what we're going to explore a little bit more tonight. So in order to understand any profession, it's important to take a look back. History helps you to understand the past, where we're going, and some of the context of the future as we think about nursing's ability to impact change. And so we'll look today at the history of nursing. There'll be a test at the end, so make sure you pay attention to the 3 chapters. We'll have a look back at the history, and then what I want to really spend some time thinking with you about is although nursing has changed and evolved to meet the needs of a changing healthcare system, there's some elements of the profession that transcend time, and we'll talk a little bit about what those are. So I also have some virtual friends who are going to help me tell the story tonight. We're going to cover a lot of content, and what my colleagues and friends are going to do, and these are all nurses at Barnes-Jewish Hospital, are going to help to illuminate some of the points and the content that's going to be covered during tonight's presentation. So we have Dr. Lynn Shalom, who's actually in the room tonight, who's our nurse scientist at Barnes-Jewish Hospital. We have Kelly Appleton, who is our leader in forensics. You don't often think about when you think about forensic, you think about law and order. You don't often think about a nurse doing that work. We have some of our nurse leaders here and an advanced practice nurse who is a nurse practitioner. And so you'll hear their voices by video as they illuminate some of the points that are being made in the presentation. So what is the history of professional nursing? We hear a lot about Florence Nightingale. What we don't hear about her is that she is the mother of professional nursing. It was back during the Crimean War where she began to articulate the fact that nursing had a unique body of knowledge. And that was really focused on how you help humans interact with their environment, environments where we live, work, play, and worship. And that's where you see this element of the human response because everyone's environment is different. Florence was our first nurse scholar, our first nurse educator, and she was also our first nurse researcher because she designed and tested an intervention that actually decreased the death rate of Crimean soldiers. So nursing as a profession, as a discipline, as an art, and as its own unique body of knowledge as a science has a very long and distinguished history. Florence laid the foundation for what we know as nursing education. There are some themes you'll see tonight about how nursing evolves based on the changing needs of the population. So Florence, there are 3 schools that were developed, and they were based on Florence's principles of humans interacting with the environment. And the 3 original schools of nursing were in Philadelphia, Boston, and New York City. And so this is the image that we see of nursing as the handmaiden to the physician, right? And so what this picture, this image depicts is really nursing in diploma programs that were really tied to hospitals, and the schools of nursing were owned by hospitals. And that's significant because during the context of the environment was that America was becoming more of there's an urbanization of America. And in the urbanization of America, what we found is that care was moving from the home into the hospitals. And so hospitals own schools of nursing, and they use labor to care for the patients. The focus of that level of education was really about practical knowledge. You lived at the hospital, and you took care of the patient 24/7. Also in the context of that was what the role of women in our society. So it was primarily a female-dominated profession. And because it was a female-dominated profession, the nurse took all of the orders from the physician. Now, many of my physician colleagues, very near and dear to my heart, love the intellectual development and partnership of nursing, but they still wish we stood when they came in the room, as happened in those days. And then, as we see World War I and World War II, nurses played a very critical and important role. But even then, nurses began to ask themselves, when our soldiers come home from war, they're sick and wounded, and they have complex care needs. Does a hospital-based diplomas program position us to meet the needs of the complex and chronically ill soldiers that are returning from war? And so then we see this debate emerging in nursing in the mid-20th century about, do we have a hospital-based training program, or do we have a bachelor's of science? Which one is going to prepare us to meet the evolving and complex needs of the patients and families that we're serving, the soldiers that we're serving? What we see is the context post-war, and we see this pattern today. Post-war, you usually get a rich economy. What happens in a rich economy? A nursing shortage. So in the 1950s and 60s, we see our first nursing shortage and the emergence of an associate's degree program. And they wanted to take the best of hospital-based nursing, practical education, with the need to move nursing into the classroom, and they focus on practical education quickly and really focus on some technical-based skills. And their goal was to produce nurses very quickly to meet the needs, to respond to the shortage. At that time, during the late 20th century, care continued to get more complex. And we see a lot of evidence in nursing about the importance of and the benefits of having a bachelor's prepared workforce. And you may hear that debate in our community. We often make that debate about nurses, but it's really a debate about patient care. Because we're evidence-based culture, we follow the evidence, and we want to make sure that patients have the most appropriate person caring for them. And there's lots and lots of data in refereed journals, pretty robust data sets that show when you have a bachelor's prepared workforce, you have better patient outcomes. At Barnes-Jewish Hospital, that's our standard, and nurses make significant contributions to the mission, and we can see that we work in an excellent, preeminent academic institution, and that's because we have really encouraged and made sure that our nurses have access to baccalaureate education. What is the master's degree? Is it because nurses want to be doctors? Is that why they get a master's degree? What you'll see throughout history is that nurses love the compassion, the human response to illness, the spending time with patients, but they want some advanced skills that allow them to meet the needs and provide more care for patients. And the master's degree is when our nurses specialize. They become an advanced nurse practitioner. They focus on midwifery, nurse anesthesia. And then we have our doctorate in nursing, which has become more prevalent over the last 20 years, recognizing that nurses need to act locally, ponder some questions, generate new knowledge, and share that knowledge to inform care locally and nationally. Remember the young teenager you met in the beginning, and if you think about magnifying that impact, doing research and magnifying it to touch other teen moms, that's the power of nursing, and that's the importance of nursing research. So nursing has evolved, it's changed, but there are some things that remain constant and unchanged. And that is, Florence talked about humans interacting with their environment. And although this is a contemporary definition of nursing in 2015, we see a lot of the elements are the same. But what has expanded is the focus on individuals, families, and communities an understanding that we need to magnify the power and impact of nursing to transform healthcare delivery and to promote the best outcomes for patients and families that we serve. But we also see in this definition a clear distinguishment of nursing's unique body of knowledge, the focus on humans. Each human is different. That's the art and the compassion. But it's also a unique body of knowledge that's separate from any other healthcare discipline. And so here we have this debate. Is nursing an art or is nursing a science? What do you think? Based on one chapter, you know it's both, right? It is both. The art allows you to meet the human's response to illness. And the science, if you look back at our philosophers of science, there's plenty of definitions of science. Thomas Kuhn, who's a philosopher of science, says that science is just replacing an old paradigm with a new paradigm. Nursing would meet that definition. Karl Popper says, you can't really falsify a hypothesis, but you can't really confirm one, but you can make sure that you critique it. And so nursing would meet that definition of science. And then to be a science, you have to clearly articulate what is your unique phenomena of concern that is different from any other discipline. And nursing has that as well. For nursing, it is really about looking at those patterns of behavior that promote positive changes. It's thinking about humans as they go through critical life events. How do they respond? Humans, as they interact with their environment, how do they respond in those critical life situations? It's about optimizing well-being. So you'll see a lot of nursing research. It's how do patients live with complex diseases? How do you get communities to have healthier behaviors? So that's the way nursing is definitely a science and has a unique phenomena of concern, unique body of knowledge.
My mom was like,
so my friends are going to tell you a little bit about why they chose nursing, and hopefully it will illuminate the art and science of nursing.
my mom was diagnosed with colon cancer and just naturally took care of my brother. And then when my mom came home from the hospital, I just made sure she was doing okay. I felt like I was helping her heal because I was doing other things that she couldn't necessarily do.
My parents and I immigrated here from the Philippines, and I know they did that, so I had the opportunity to do what I wanted. My mom is a nurse. That wasn't my original path. I originally was pre-med at St. Louis University, took my MCAT, and instead of applying to medical school, I applied to nursing school.
When I was coming out of high school, I didn't know what I wanted to do. That Monday through Friday, 8 to 3 thing was not for me. So then I went to nursing school and learned as I went through more and more about truly what it means to be a nurse.
So seeing that I really wanted to get to know the patients and get to know their families, why they're there, what their problems are in the hospital and outside of the hospital, and just kind of get to know them that in depth, pushed me towards the nursing career.
I just love that interaction with the patients and being able to care for them hands-on. For a patient to feel like you care helps them heal, and it helps them feel a little bit better even in a difficult situation.
One of the things that I find the most rewarding and why I wanted to become a nurse practitioner, because you make such a connection. It is the most profoundly rewarding thing that you'll do.
I just care about the well-being of people. I don't ever want to see people sick, but if I do see someone sick, I want to help them feel better even in the moment.
Being able to advance your career and do meaningful work, I think, is the number one thing on my list.
We are the translators. We are the people who help patients navigate what is becoming more and more a complex healthcare system. And we really individualize their plan of care and help them navigate not only what they're dealing with, but the system itself.
So what you hear is not individuals who wanted to be physicians and settle for nursing. Paulo says he took the MCAS, was prepared to go to medical school, but was attracted to the opportunity to walk the journey with patients as they go through some of the critical times in their lives, to promote safety, well-being, to have sacred relationships with partners, with patients that develop over time, the opportunity to provide caring, compassion, and promote health in the context of illness, to walk with patients as they interact with their environment, understanding each response, human response, is often different. So as we close our first chapter on a look back, this presentation has forced me to look back on my career. I will not admit at home that I'm old, but I am becoming more seasoned, and I've been a nurse 25 years. And so you see in the picture, my grandmother, she's cheering. And I'm thinking, what was she thinking on that day? She's thinking, my granddaughter has become a nurse. She's going to work in the hospital for the majority of her career. I'm in the picture, the president of my class, and I'm calling my classmates to be great nurses. And what I charged them to do was to make sure that they attended rounds with with physicians, and that they raised their voices, that they were fierce advocates for their patients. I didn't talk about families or communities. I didn't talk about technology. And I thought back, there was no email when I graduated in just 25 years, and there wasn't an electronic medical record. So in fact, last year when we launched our electronic medical record, I had the privilege of being there when we actually switched from one electronic medical record to the other. And I said to some of my colleagues on the floor, we're not gonna change over as planned. You'll have to go back to paper and do your care plans on paper. And they said, what? How do you do that? In only 25 years, what a difference. When I walk through our oncology clinics, our patients are getting chemotherapy and then going home that same day. When I graduated, we were doing all chemotherapy inpatient with a long length of stay. A length of stay that would bankrupt us right now. It's so different. When I think about surgery, most of surgeries were inpatient with long lengths of stay. And if you wanted to be an expert nurse, your only choice was to be a nurse manager. That meant you were expert. Even the role of the chief nurse executive, it's not focused as much, it's focused on nursing, but a lot of it is helping the organization design models of care. So even in 25 years, nursing has changed a tremendous amount, evolving in response to the needs of our patients, families, and our environment. So today's nurse. There are several landmark events that have framed the profession of nursing today and the work of today's nurse. The first is we are embarking on healthcare change. How many have heard of healthcare reform? We call it the Affordable Care Act. We don't know what's going to happen in Washington, but that's one of the things back in 2008 that really framed the work of today's nurse. And there was a realization that nursing as the largest profession would play a pivotal role. And that nursing was positioned to play a pivotal role because of the baccalaureate education and the path of baccalaureate education, the focus on transitions of care, care in different care environments, how to work together as a team. And so the skills that are needed, I was calling my colleagues to just raise their voices at rounds. And really, we're realizing that healthcare is a team sport. So nurses are going to have to work more as a part of an integrated team. And then we have a focus on quality and outcomes that hadn't been there. I didn't talk to my class about patient experience when I was addressing them because that wasn't something that we measured and made such an impact on the success of our organization. So these are the skills that we require for contemporary nurses to care for the complex patients, families, and the community that we serve. In recognition of that, we had a landmark report in 2008 from the Institute of Medicine, now the National Academies of Medicine. And so there was a charge by the Robert Johnson Foundation and the National Academies of Medicine. They understood that if we don't make sure nurses are prepared to make a significant contribution to healthcare delivery, we won't be able to change and improve healthcare in this country. So they sat down and said, the largest workforce, what do we need to do to ensure they're ready to help us transform our healthcare system? And out of that, there were 4 recommendations, and 3 that we focus on and really shape the work of today. And that's to practice to the full extent, nurses should practice to the full extent of their licensure and training. What does that mean? It means that we really want nurses to help us to manage some things like transitions of care. We want them to be focused on assessment, developing those sacred partnerships, being in communities and helping to optimize health and transform care delivery. The nurses should achieve higher levels of education. And that's really a recognition of a lot of the data that shows patients have better outcomes when you have a more educated workforce. Also the recognition that nurses will be in a diversity of roles in our healthcare system. And so we need to make sure that nurses were prepared at the baccalaureate level for entry into practice, but also at the master's level to provide advanced care, and then at the doctoral level, both to educate the next generation of clinicians, but also to design and test innovative model of care that are going to improve the health and well-being of our nation. So that is the frame and one of the seminal events that happened that is shaping the work of today's nurse. And then our magnet recognition and magnet criteria. Magnet criteria really was a lot of studies that demonstrated if you created the environment where nurses could have access to all of those skills, understand policy, that they were at the highest levels of the organization, that they were well positioned to have a spirit of inquiry, participate in research, and share their knowledge, that you would have better patient outcomes. It would help your organization to meet its mission. And so I'm proud to say that I get to lead the best nurses in the entire world, hands down, at Barnes-Jewish Hospital. And we are smiling because we just received our fourth magnet designation last year in 2018. We are 20 years of nursing excellence. And magnet is also, thank you, a recognition of how nursing is integrated into your organization and part of the team. And we know at Barnes-Jewish Hospital, we've been able to maintain our national preeminence for many reasons, and part of that is because our hospital has been committed to creating an amazing environment for our nurses. So what does nursing look like by the numbers? We have now about 3 million nurses. And so nursing has grown exponentially over the last 20 years, 30 years, 40 years. It's becoming more diverse in terms of gender and race, and that's significant because nursing had been only a female-dominated profession. Men thought that nursing didn't have a lot of credibility as a profession, so the fact that we're having gender diversity speaks to the attractiveness of the profession. Also, we're becoming more diverse. That is both because internally, nursing is recognizing the value of a diverse team and creating those opportunities. And also we're understanding the importance of reflecting the communities that we serve as we work on the social determinants of health, where our patients live, work, and play, those social factors that keep them from being healthy. It's important to make sure that the members of the nursing team look like the communities that we serve. So where are nurses practicing? Everywhere at Barnes-Jewish Hospital. I cannot think of a department where nurses are not really engaged and respected members of our healthcare team. So they are all over.
You never really quite understand.
And so our team members are going to tell you a little bit about the roles that they play in nursing.
You never really quite understand what it is and how in-depth of a career it is until you're in there and you're doing it. And then you realize that this is my calling, this is what I wanted to do with my life.
We go above and beyond to take care of those people that we love, those people that we don't know but somebody else loves.
When you get a group of patients and you have strong research, then you're impacting it for multiple patients across the country and internationally, and that's what is so rewarding, is to see this global effect that our team can have to improve outcomes for patients and families.
I have a master's in forensic nursing, and with that, I'm able to help more victims. We have human trafficking, sexual assault, domestic violence, elder abuse, child abuse. I am helping develop a curriculum for forensic nursing, currently a post-baccalaureate certificate, and that will grow into a master's degree through Goldfarb School of Nursing and eventually a DP or PhD.
I am the Director of Research, and in that role I conduct my own research as well as mentor many staff. We help them take what the research tells us and put it into practice in their work area. Other times there's not enough research or there's a piece missing, and so we start a research project.
I started working with this group of surgeons who actually do deep brain stimulators, where they implant a piece of lead or lead into the brain, seeing the tremors go from a very high tremor to a no tremor, and just reflecting to the quality of life that person has after that. That is what we're known for. Nursing is very diverse. It has something for everybody out there. If you want to get into research, if you want to work in a very robust environment like the OR, ICU, ED, on the floor, if you want to have that direct patient care where you're having to talk to patients and their family, you can get that in nursing. If you want to do data, you can get that in nursing.
With the research in the hospital, the best part about that is that we can address needs and issues right in the moment.
We're in the forefront and we're creating and we're developing. There's so much to do and there's so many people that you can reach out to.
I see the smiles of the patients, the smiles of the staff members. I see the challenges. You know, this is a time when people are at their most vulnerable state, and we chime in and we come together as a team and we give these patients and their loved ones and their family the best care that we have. And that just warms my heart every day I come to work.
Isn't that amazing? And you don't hear the voice of patients here, but it also warms the hearts of patients. In my role, I'm always fortunate to get amazing letters from our patients and families. And one of the most recent letters I got was from another nurse. And she said, you know, as a nurse, I know that the science can be taught, but the art of compassion can't always be learned. But because you provided a nursing team that has both the art and science, the commitment and compassion, as I faced losing my grandson and making the decision to take him off life support, it was an experience that gave me both joy and sorrow. But that's because of the sacred relationships that we have the opportunity to build with our patients and families. So at Barnes-Jewish Hospital, because we understand the value and work of the nurse, it's not just okay for us that they're impacting patients and contributing within our team. One measure of success for us is that they're sharing, acting locally, and sharing their knowledge locally and globally. So we're encouraging our nurses to make sure that they're engaged in scholarship, that they're asking questions in their practice, and that they're generating new knowledge for practice that can inform care more locally, nationally, and globally. We have a lot of work to do to make sure nurses have the time to do this work, but for us, it's very important. We're continuing to ask, what are you doing in terms of scholarship? We make sure that we have programs that support nurses and give them the time to be able to develop those research, and then we can use that knowledge that's generated to improve patient care. So everybody got their crystal ball? As we look into the future of nursing, the future of healthcare. Cold night, this should resonate with all of you. Care is continuing to become more complex. Lots of different priorities. And the work for our teams is to bring high reliability or order in the midst of chaos and continue to help us to design and improve our healthcare system. So we talk a little bit about the quadruple aim in healthcare. What does that mean? It means that we're going to have more of a focus on patients' experience of care, the outcomes of care. We're going to be focused more on optimizing health and well-being. We're going to be focused on the well-being of our caregivers, and that if we do all those things and do them well, that we will reduce the cost of care. And if you think about the definition of nursing is really aligned with the mandates of the Quadruple Aim. Patient experience. That's a lot about human response, how humans experience the care they receive. If you think about population health, if we can magnify the impact of nursing as they focus on health and well-being and optimizing function and complex disease management, we will impact the health of our nation. And if we do those things, and we do those things well, we will reduce the cost. So if you think of achieving the Quadruple Aim and the skills and education of the nurse, there is an alignment with nursing's ability to help us achieve that noble goal of reaching the Quadruple Aim. And so we're moving more from a phase of transactional care, where you can touch the IV or you can give the medication, the clinical therapeutics, and more to a transformational practice. What does transformational practice look like? It's looking at those healthy patterns of behavior and magnifying them so that you keep patients healthy. We know that even within the context of illness, you can have optimum functioning within the context of illness. And so the transformational nurse thinks about those patterns of behavior and then tries to replicate them with individuals, communities, and population. So the transformational nurse is really the skills that we need for nurses to have in the future. And some examples of how that looks in our care environment, I got a note from an ICU patient, and she shared that she struggled with anxiety. She didn't want to leave the ICU. Often patients come in and they don't want to leave the ICU because of the comfort of having one nurse caring for them. And she said, my nurse gave me 5 things to do. And she wrote them down on a piece of paper. We reviewed them every day, and she said, every day when you get anxious and you want to come back, do those 5 things. And the 5 things were, you got this, you rock, you will beat the odds, there is nothing that you can't do, take a deep breath and smile every day. And so you think about care transitions and we think about readmissions and we think that we need really sophisticated interventions. But this patient, when she read that, she said that allowed her to relax, take her medication, do what she's supposed to do so she didn't end up back in our hospital. What if we could magnify that? What if nurses had the opportunity to develop these sacred relationships with patients and they could replicate that effect? That would have such an impact on our transitions of care and our readmission challenges. The other story I have was from our DAISY Award winner. And we have the DAISY Award at Barnes-Jewish Hospital. It's one way that we acknowledge the exceptional care that our nurses give to patients and families. And we give those awards very frequently. With 3,500 nurses, we have to acknowledge excellence as frequently as we can. And one of the letters was really, they usually come from patients. Patients can write them, and our staff can write them. And one of the letters may seem simple, but so powerful. A patient was scared to go home. She had an asthma exacerbation, and she did not want to leave the hospital. And when the nurse talked with her time and time again, it finally emerged. The reason she didn't want to go home was because part of her treatment was to get a respiratory treatment at home. One, that respiratory treatment cost money, and the other thing is she was getting her electricity turned off. And so the nurse spent all day on the phone with Amarin, made sure her electricity was restored, and the patient was able to go home and not come back to us. If we had a system where nurses could spend the time with follow-up phone calls, being in the community, helping patients navigate, as one of my colleagues said, we could replicate that impact and help us with some of the readmissions and keeping patients home and healthy in the community.
Always ask, what can we do better? What can we do better for the next day, and what can we do better for the future? And taking that input and incorporating that into our everyday work really does make our life so much better.
Research is going to continue to expand. I think more bedside clinicians will stay at the bedside and be conducting research, and I think we'll use more technology.
Always learning, always getting better, always learning more. Also, it is a lot to keep up with. So I think we have to have an expectation at the onset of that that we are somebody who wants those challenges, who wants to continue growing and learning.
I really want to have freestanding clinics. I want a forensic program. I think that we need this for the nursing forensics. I think we need this for all of our victims.
The manager role has to evolve with our generations that are coming in from nursing school. There's a big nursing shortage, and there's a big push to retain our nurses. And how do we do that? It's supporting them through their career, having good, deep, meaningful conversations with them, so that you build that trust. You build that rapport with them. You know what they want to do. That way we can, show them how they can do that within our organization.
And so it's really important to make sure that you know yourself, you know your limitations, but then also challenge yourself a little bit, because not everything is going to be easy. And if you don't have that drive to push yourself a little bit harder and a little bit further, then you're never going to grow.
That's our colleagues talking about the future of nursing, the future challenges, and the opportunities that they see. So, what will the future look like in terms of the supply of nurses? So 51% of our nurses will be over the age of 50 in the next couple of years. I used to always be on the other side of that, and so that's a powerful statistic. But we will need 200,000 more nurses by 2026 to meet the needs of patients and families. Now we could become alarmed by this, but this is also a good news story. The demand for nursing is increasing, and the diversity of roles and places where nursing can make a contribution is increasing. So when you think about the hospital, our competition for talent looks different than it did 25 years ago. Our competition for talent is now CVS, Walmart, right? It's forensic nursing, it's faculty, it's even politics. I'm not sure if you know that one of our congresswomen in Illinois is a nurse. And so there are so many diversity of roles as the public realizes that these skills nursing has of building partnerships with community, building partnerships with patients, has such potential to optimize health that there's a diversity of roles where nurses are serving. So we have to work really hard to make sure that bedside nursing remains attractive, but we also have to prepare nurses to play a pivotal role in these other roles that are emerging over time. I wanted to assure you, as you leave here today, how is Bronx Jewish Hospital? That's a big number, 200,000. I want to put it in context. We have a really great nursing workforce. I wanted to show you that the Missouri total in terms of turnover is 15.2%, and ours is significantly lower than that because of the environment that we're creating. So have no fear as we talk about the future. Right now, we're able to provide exceptional care to the patients and families that we serve. But what will the future of nursing look like? There are a couple things that we know that we will face in the future if we look in our crystal balls. And one is that the population is getting older. And with age and living longer comes some healthcare challenges and healthcare complexity. And we want to keep our older adults home with optimum functioning as long as possible, a critical role for nursing to help that happen. That we want to create a culture of health, optimize health and well-being in populations and communities to help to drive down our healthcare costs. And because it's the right thing to make sure that we have a healthy nation, that will be the work of nursing. We know that technology, although it's an enabler, it brings some complexity to the care that we provide, and that we'll need nurses skilled in helping us to design technology that supports best practice. So if you think about the work of nursing ahead, the work that's ahead in terms of healthcare, nursing is positioned, and we need your help and support to make sure that they are well positioned to help us to meet the challenges that are ahead. We know they have the skills. We know that the art of compassion really makes them effective at developing trusting relationships with patients and families. We want to magnify that impact to community and populations. So, as I close and bring our final chapter to a close, nursing continues to be the most trusted healthcare professional. And I thought this study was particularly, or this survey was particularly insightful about nursing because this is a study done by the Harvard School of Public Health, the Commonwealth Fund, and the New York Times. And the study asked individuals about their beliefs about healthcare reform. And their answers were very bipartisan. Some said Medicare for all. Some said the Republicans should take back control. And I don't want to get into a political debate, but what I wanted to illuminate was that everyone agreed, regardless of party, that nurses are the most trusted profession and most well-positioned to help us to meet the healthcare challenges of the future. And so we ask for your support. We look forward to developing a partnership with all of you because in order to meet the healthcare demands of the future, we know nursing is the most trusted profession. We looked at the definition of nursing and how it's evolved over time. What has been consistent is the kindness, caring, compassion, and how that's made a difference in the lives of patients and families. And so we ask for your support to unleash the power of nursing to help us to solve some of the complex problems that we have ahead. And as I close, I look forward to developing a partnership with all of you to think together about as we are moving to the shared goal advancing the shared goal that I started with of improving the health of patients, families, and the communities we serve, I look forward to uncovering with you ways to use nursing to help us accomplish that goal and to unleash the power of nursing to transform our healthcare system. Thank you.
Yes, standing ovation, you bet. So, might be historically cold. This has really warmed our hearts. I really picked up on that phrase, hasn't it? And the other thing about nurses is that we have things timed down very perfectly. And Angelleen has left time for questions. So what questions do you have for Angelleen? We have a few minutes.
What's the difference between a nurse practitioner and physician's assistant? And the second is, in your capacity, you cover all of the BJ hospitals or just Barnes?
I cover just Barnes Jewish Hospital. That's more than a full-time job. And Denise Murphy here covers all of the BJC hospitals. And to your second question, the difference you asked the question about the difference between a physician assistant and a nurse practitioner. Although both are very important and play an important role in the healthcare system, their education and training prepares them for different things. A nurse practitioner is a nurse with advanced skills, caring, compassion, human response that's getting advanced skills in assessment, diagnosis, and prescriptive authority. And gains prescriptive authority. A physician assistant and the nurse practitioner is an independent provider that collaborates with physicians for the care of complex patients. A physician assistant is an extension of the physician. And so they practice under the license of the physician, and where you see they're educated in a medical model, and you see them in areas like procedural areas and others where physicians practice. Does that make it? They both receive master's degree, but the foundation and focus of the education is different. The physician assistant is disease treatment and management, and the nurse practitioners who are living with chronic disease and how you manage your symptoms.
Another question.
Sure.
I noticed that Goldfarb is down in the Central West End, but it's also out at Moldau. Is it elsewhere? And do they go in?
I have to repeat your question, right? Your question is, does Goldfarb have a campus in the Central West End at MOBAP, and are there others? I'm going to look to my colleague Nancy to see the answer, to find out the answer to that question.
Yes, there is a campus at MOBAP, and it is an extension of the campus at Central West End. Just those two.
Are there going to be more?
Build me a building.
Good evening.
Good evening.
My question is about nursing and technology
Mhm.
and how technology and nursing may help us bridge some of the healthcare gaps. If you could say more about that, especially in underserved communities.
So there's a couple of ways. How can nursing bridge the gap between technology and the populations that we care for? And one is using technology to provide care and to provide consultation. So one is the way we communicate with patients. We can use technology to communicate with patients, and then having some virtual visits so that we can deliver care and advice using technology. Maybe one way we can do that. Everybody loves to be texted, and I always used to think that underserved populations, that using technology to communicate with them may not be effective. But actually, we've learned that everyone has access to some kind of electronic device. So notification and reminders in terms of chronic disease management will be critical in the future.
I hope you sleep well at night, but when you're not sleeping well, what do you worry about?
So my husband is here, and he can tell you that nothing keeps me up at night. I think I was designed for this job because with all the complexities, I can sleep through anything. What keeps me up at night? Making sure that we have an adequate supply of nurses, and not just that they have the skills to meet the needs of complex patients and families, and the time to really practice nursing as it's intended to be practiced. So the time for education with patients, the time for developing those relationships, and the time for designing a care plan that's effective over time.
Angelleen, you are the best and brightest nurse in all of BJC.
Oh my gosh.
Thank you enough. Lots of wonderful nurses across BJC. So I have a 20-second story and then a question for you about what we can use our partners in this room to do. So on Sunday evening, I was having dinner with my husband and a physician friend and his wife, and the host said, the little 10-year-old boy said to us, "What do you do?" And so my physician friend said, I'm a doctor. And he looked at me and said, what do you do? I said, I'm a nurse. And so his mother said, do you know what doctors and nurses do? He said, oh, I definitely know what doctors do. They have a really great job. I said, do you know what nurses do? He said, yes, they help doctors. And I said, you're so right. We do help doctors, but we do lots of things for lots of people. Would you like to know more about what nurses do? And he said, no, thank you. I'm a boy. So we have lots of work to do. And
Yes.
you have an entire room full of people. So what is your ask of this room in terms of helping us recruit some of the best and brightest people in our region?
I think a really thorough understanding of the potential of nursing, of both an art and a science, and the potential of nursing to transform healthcare delivery, and the important impact that we make on the lives of patients, families, and our organizations. It's very different than it was before. The work of nursing is pretty transparent in terms of outcomes. And so I would ask that as you talk with others in the community, that you're able to share the unique contribution of nursing as a profession in its own right.
And start young.
And start young. I used to be young one day, but.
Larry has a question. Larry.
Hi, Larry.
Angelleen,
Yes.
so I know that recruiting you from a wonderful place in Rhode Island. You decided to come here, and we're happy that you're here. So tell us about what got you to come here, and what's been your experience here versus where you were.
Let me just begin by saying, I love it here. Every day we wake up, my family, and know that we made the right decision because of the team that we work with and the amazing hospital that Barnes-Jewish Hospital is. But I didn't want to come in the beginning. I didn't want to come. But the reason that I did come is because when I came here for my first visit, I found alignment with our team. It's a small senior team, and although we play different roles, there was an alignment of values and commitment to both parts of our mission, being an academically preeminent organization, and what we are so proud of is that we care for the most vulnerable and underserved, and we take both of those missions very seriously, and we honor them both. And so to work with like-minded team members who honor those both parts of our mission was just an opportunity that I couldn't refuse, because I don't feel that that is something that you find all the time. And then the unique and special thing about Barnes-Jewish Hospital that no other country in the hospital has is that we are a safety net hospital, and we are one of the best hospitals in the country. So those who are in our safety net mission get the very best care and chance at health and optimal functioning. And so that's what we're most proud of, and that's what brought me here. And every day, I know that we live those missions. Those days are not always easy, which is why I sleep well, but I'm confident that we're living the mission.
I know that you all deal with very complex situations. One of those is turnover. Every hospital in the country, every nursing staff is dealing with turnover. And it looks like we're having progress. I know we are having progress in Barnes-Jewish, but if you had to name two things that are the most important to control turnover, what would those be?
This is a complex answer, because one of the reasons that we have turnover is because of the complexity of our institution, the academic preeminence and caring for the mission. And because we haven't brought in as many staff as we would like, the workload is high. So if we could bring in more staff and create more opportunities for education and training with your help, so that nurses would stay with us longer over time and build their career with us, we believe that that will help us with our turnover. The resources to surround the nurse at the bedside.
Aren't we the luckiest to have Barnes-Jewish Hospital in St. Louis and to have those nurses? So we thank you for being here. We'll have more time for fellowship and more questions for Angelleen and others in the room, and we have more refreshments. Our Leading Edge Medicine and Leading Edge Nursing Now series will pick up after the first of the year. Thanks so much for all you do. Thanks so much for all your support. Appreciate it.